Alright, so we're going to talk about the Shepherd Hook Explorer today, and this is the instrument that you have. It is a double-ended, unpaired instrument. I have a Shepherd Hook Explorer on one end. I have a periodontal probe on the opposite end. It also says XP23. The Shepherd Hook is often called the number 23, and we talked a little bit about the design of the instrument, knowing the handle. So this is my handle, this is my shank. All of this is the functional shank. It's very hard to see working end, terminal shank and functional shank on the Explorer. So I'm going to literally just take my thumb here. I'm going to cover what I would call the working end. All of this is the functional shank. This little part right here is the terminal shank. So if I were to hold this instrument up right here, and you can see that little bit of a back, that would be the terminal shank. Alright, so once again, that's the terminal shank. Now, the working end is very different on our assessment instruments. So what you'll want to tell us is that this is an assessment instrument. It has a pointed tip. The working end is circular in cross section, so it's round. It's a circle in cross section. We typically use just the first couple of millimeters, the side of the instrument. It could be the face or the back or a lateral side, or the pointed tip. We typically don't say these instruments have a face, a back, and two lateral sides, but I'm going to add it. So if I hold this up and you've got that pointed tip looking at you, we'll call that the face, we'll call that the back, and each side we'll call a lateral side. Even though it is an assessment instrument, it's round in cross section, it has no cutting edges. So what I'm going to demonstrate is the different clock positions for the different sextants. So I'm going to start with the surfaces away on the posterior, and I would need to use my mirror. I'm going to be in 10 or 11 o'clock for those posterior sextants. So it's me, my patient. My patient's head is turned towards me. I do not have the light on for videoing, but I'm going to hold now this instrument in my hand. There's my grasp, and since I'm doing the maxilla, it's going to be pointing up towards the maxilla. And I'll just show this on tooth number 3, and then I'll do 3, 4, and 5. So I am in 10 or 11. I can go ahead and do that occlusal surface. And what we're doing is we're tracing the grooves. And this one happens to have an amalgam restoration, and it's got a little opening right there. And that's exactly what we would be recording, checking the margins of the restorations. And then I'm in 10 or 11. I'm going to roll it, and I'm just on the lateral side, and I'm just checking that smooth surface. We're going to keep you only on the occlusal half of the teeth. We don't want you going near the gum line. Now what I can do is I'm rolling a little bit on a lateral side on that mesial. When I come across on the lingual, I can come up on that point to feel that buccal groove, and then I can continue on that lateral side, opposite lateral side, and come across. And now I can go to the next tooth, and I'm going to just repeat that. Just tracing the pits and fissures or the restorations if they have it in the lateral side. And then there's number 5, same thing. Now I'm going to go over to the maxillary left, and it's going to be the same thing. I'm going to retract that cheek, and I'm going to trace all of the grooves. And you can stay on that tooth, and you can do the lateral side. You can roll up on that pointed tip if they had a prominent buccal groove or a lingual groove. So in other words, when an instrument is cross-section, if it's a circle, that means you can use all sides. I'm just checking these restorations, and we would record any anomalies, whether it was an open margin or a suspect site. So I did 10 and 11. I'm going to go down to the mandible. And I'm going to, this is where we can be 1 to 4 teeth away with our fulcrum, and we can reach. So I am reaching with this assessment instrument. I can reach, I can trace this tooth, I can go back and forth over the margins of that restoration. I'm going to come on the lateral surface. There's got a buccal groove. I want to feel that buccal groove, make sure that there's no pits in that. And then I'm going to continue on. So what you'll want to determine is, which clock position, what can you get done in all these clock positions. I'm moving to the lower right posteriors. I'm just going to start with 30, and we have a wiggly tooth. So we're checking those restorations. There's a little open margin right there. We would note that, a little open groove. And I like to think of fillings like potholes. They do have openings from time to time. So this is what we're doing. We're just staying supra gingival only. Now I'm in 10 or 11 o'clock. I did my posterior surfaces away. What I can do is I can go right to my anterior sextants in the 10 or 11, or I can go up to 12. I'm going to start away from me, and I'm just going to feel those two smooth surfaces coming across those anterior teeth, like so. If they had attrition, you can maybe feel that occlusal, but incisal edge, you don't have to. And then I can bring my mirror in, and I can do the same thing from the lingual aspect. So yes, you can keep your same clock positions. I'll show you that. But with this instrument, you can also have a variation. It's very easy to do. Here's the maxillary anterior sextant. I'm going to use direct vision. And you know, we typically aren't really even using a shepherd hook on the anterior teeth. It is really mostly for posterior teeth. But here's a tooth that's got some anomalies. It's got some pitting, and it's got some fractures on the incisal edge. And so we're just trying to feel for those types of fractures or anomalies. I'd bring my mirror in direct vision, to do the lingual aspect. So we essentially have the maxillary and the mandibular anterior teeth done. We have the surfaces away for posterior teeth. I can drop down to 9 o'clock for posterior surfaces towards me. And if I wanted to use the mirror to retract the cheek here, once again I can fulcrum and I can reach and I can feel all of these buccal grooves rolling up to feel that buccal groove. And then I can come down to the bottom and do the same thing. If you notice, it's always pointing. If I'm on the mandible, it's pointing down. If I'm on the maxilla, it's pointing up towards the gum line, even though we're not going near it. So you want to trace all of these restorations. Now, you just see what I did? I did the occlusal there. So I did the occlusals from the 10 or 11, but you can also do them from the 9. So that's your choice to make that decision where you want to do them, what's most comfortable for you. And now I'm going to go and do the lingual of the mandibular. And I would just trace those surfaces towards me, which is the lingual, and I can also do those occlusals. Now you don't have to do the occlusals twice. You can choose whether you want to do it in your 9 o'clock position or your 10 or 11 o'clock position or 12. Some of you guys want to stay consistent with the anterior teeth surfaces towards and away, so it would look like so. So we can do it from the different clock positions, and we're always bringing in our mirror for indirect vision to feel those out. I would recommend, if you're going to do the maxillary anterior sextant, you can do it in that 10 or 11 or 11 to 12 o'clock, 11 to 1 o'clock position.